Hello friends, today we'll talk about another important vitamin, and that is vitamin B12. So I will briefly talk about who are the people who are prone to get vitamin B12 deficiency. We know that vegetarian diet doesn't have adequate vitamin B12, so they are the most likely to suffer from this deficiency. But one should always remember that it can also occur in non-vegetarians, because some people can have abnormal antibodies in the gut, like anti-intrinsic factor antibodies or anti-parietal cell antibodies, and that doesn't allow the vitamin B12 to get properly absorbed. So almost 1/3 of non-vegetarians can also suffer from vitamin B12 deficiency. Then the third category can be older people, or then fourth, those who have undergone some kind of GI or gut surgeries or bariatric surgeries, or those who have something called malabsorption, where even if they eat food, it doesn't get properly absorbed. So these are the people who are likely to get vitamin B12 deficiency, but one should always be on the lookout. So for that, we should know what are the common symptoms of B12 deficiency. So commonly it affects the nervous system and the blood. In the blood, it is important for formation or synthesis of hemoglobin. So with vitamin B12 deficiency, there can be drop in the hemoglobin, and as a result of anemia, there can be fatigue, weakness, tiredness, breathing difficulty, especially on exertion. So those are the common symptoms. It can affect nervous system, in that the most common is tingling, paresthesias, burning or pain in the feet and hands, and also the brain. So they have poor attention, focus, concentration, memory impairment, and severe cases there can be dementia also. And then there are some skin changes. So one is there can be hyperpigmentation of the knuckles, also on the tongue. And then there is something called as anglostomatitis or cheilitis, which are involvement of the tongue and the angles of the mouth. So if anyone has these symptoms what I described, definitely testing should be done. Even normally it is better to test vitamin B12 at least once a year, so that one can diagnose B12 deficiency even before they cause symptoms, and early treatment can be started, because we know that the outcomes are better if treatment is given early. So for treatment, we have tablets as well as injections, and then based on the vitamin B12 levels and also the presence of symptoms and the reasons for underlying B12 deficiency, one may decide to choose injections over tablets. And for maintenance, when the symptoms have subsided, tablets may be sufficient. And then finally, what are the natural sources from where we can get vitamin B12? So most of the good sources are from the non-vegetarian diet, which includes everything right from eggs, poultry, chicken, and then red meat. All of them have good amounts of B12. In the dairy also, small amounts of B12 may be there, but in the plant-based diets, there is no vitamin B12. So if you are looking for a plant-based diet only, then you can continue with the diet, but you most likely will need to take B12 supplements also. So I hope you learned something from it, and I'll be happy to get your feedback on this. Have a nice day.